this is a strengthening exercise for our knee. This is called a short arc. This activates the VMO, or the vastus medialis oblique muscle, that's here on this medial side of the quad. This muscle is active in the last 20 to 30 degrees of knee extension, and oftentimes in many athletes it's not firing correctly and they often experience some knee pain, so this is a great exercise to do in that regard. So the way to do it, usually we'd have a bolster here, but with our circumstances we're using this chair, and so we have my patient Eric here in a slight knee flexion, about 20-30 degrees of knee flexion, and he's going to contract the quads to then extend the knee fully straight. And so then it's firing this muscle over here predominantly. Good. Usually we do about 3 sets of 10 of these. We can bump it up depending on how easy or hard it is for the patient.
So this next exercise is called the Nordic curl. This one really focuses primarily on the hamstring because all it's going to be is you're going to hold your patient's legs. You can either grab the ankles here, but sometimes, if, like in this instance where there's a little bit of gap, it's going to be a little bit uncomfortable. So you can come up here higher on the calves. The other thing you would probably want to do is make sure you have like an Eric's pad or some sort of foam underneath your knees so that she doesn't have that increased pain there. So what I'm going to instruct Laura to do is go ahead and go forward till she feels comfortable. A little bit more, okay? And then she's going to bring her body back. So this one doesn't have to be very much because you're using the whole body weight to contract against. So one thing you can do as your patient increases in strength, you can have them go further and further. Obviously here, I'm not going to want to do too much in the beginning because more going to be coming back from my hamstring strain and that more the mild or the middle phases toward the end. But here again, if you have someone that has super tight hamstrings or has other problems, you have a risk of possibly tearing some of the hamstrings because this is such a demanding exercise.
Okay, so this next strength and endurance exercise is a repeated contraction, which is part of our PNF strengthening techniques. We're going to focus on the hamstrings. We're going to isolate the hip movement, so we're just getting that knee flexion in here. The best way to explain this is a way of having the patient push against your hand so that they win, and then I push them down so that I win, technically. And this is isolating those hamstrings, strengthening those as we're going along. It's called repeated contractions because we're doing this multiple times each set. So usually you can do about 6 to 10 reps of these per set, and it really works that hamstring strength. So we're really going to do this now, so push up. Good, now let me win. Good, again. Good. Here. So we're getting that eccentric and concentric contraction of the hamstrings with this movement, and the eccentric is actually going to make the hamstring quite sore, and so this is an exercise we would do maybe every other day to give the hamstring some rest, but it is a great strengthening technique.